When someone has a passion for what they do, it comes through in the product they provide their customers. Just ask LaRocco's Pizza's new owner, Jason Johnson, about their crust. They make it every day and let it rise for a minimum of 24 hours before they use it for their pizza. And his staff doesn't want to do anything they won't be the best at, and you can taste it in their pizza. LaRocco's Pizza, just a half block north of the I-470 Engage Boulevard exit. Come taste the difference.
It's the season for brand new mulch, and Brown's Tree Service has got your yard covered. Brown's Tree Service utilizes hardwood mulch that retains more moisture. Not only does mulch make your yard more appealing, it also reduces weeds, improves soil, and creates insulation for plants. Get the right mulch for your job at Brown's Tree Service. They shred it, haul it, and spread it in bulk. Or you can haul it yourself for the personal touch to your property. Call Brown's Tree Service at 785-379-9212 or visit online at brownstreeservicelc.com.
It's time for Real Estate 101 with the Carrie Brown team from Preferred Advisors.
Good Saturday morning to you. This is Carrie Brown, Associate Broker with eXp Realty and the Preferred Advisors team, and you're listening to Real Estate 101. And I am here today with my co-host, obviously Dr. Heriter and Dr. Holly Cobb, registered nurse practitioner, have been my co-hosts for the month, and I'm sad to see this be the last one. It's been a lot of fun. But I'm here today with Dr. Jennifer Heriter. Good morning. How are you?
Good morning. Good, Carrie. How are you doing?
Doing great.
Good. Thank you so much for having us on this month. It has really been fun.
I think just having a calm voice and, just saying, hey, it's okay to freak out a little bit, and it's probably anxiety and not COVID has been really helpful.
Good. It's been nice for us, too, because it's been a way to kind of talk about what we're learning as well. So thank you again.
So we'll get off of the COVID bandwagon here for a little bit. I really want people to understand what you guys are about. We've hit on a little bit here and there, but not a whole lot. Obviously, we've talked about how you guys came to do the practice, but what do you love most about what you're doing at Oasis?
What I love most about what we're doing at Oasis is that our goal is really about what is the best way to take care of each individual patient. And that comes from a lot of different meanings, I guess I would say. But, our job we look at as to first do no harm, and so of course we mean that from a treatment standpoint and a medical standpoint, but we also mean that in our case from a financial standpoint. And so when we are making a decision about what to do for our patient that's sitting in front of us in the room, we really get to consider what's the most evidence-based way to treat them from a medical standpoint, and then what's the best way to accomplish that being financially responsible as well. And it really is extremely satisfying.
And being a patient there, I can absolutely say I never feel rushed. They talk to me, ask me how I'm feeling. If it's something that I feel like has happened before, I can call Holly or I can text her and say, hey, this is what I'm thinking. Does this sound right? Obviously, there have been times late at night where I've had to text over a kid, and I start with, I'm sorry, it's so late. Things like this only happen at this hour in the Brown house.
Yeah.
And she will text me back and say, okay, this one we got to see you for, or, oh, okay, that's just poison ivy or something like that. It's really nice to have that relationship. You don't feel like, I have to go through the whole red tape and then go in and then get with this massive bill. I love that we just pay each month, and it doesn't matter if we go 10 times or if we don't go at all. It's the same no matter what, and there's never any crazy bill right after. I love the whole atmosphere of it all. It's very, very relaxed, and everybody's really, really friendly, and you can tell that they care.
Yeah, thank you for that. I'm glad that that comes through for sure for you and your family as patients at the clinic, because that's really what we want. We schedule our appointments with a much longer time in mind, and sometimes it doesn't take that long, and we don't need to be here for an entire hour, for example, but we have the time if it's needed. And I think as patients we get trained pretty quickly to come in prepared to talk about one thing and to have someone's attention for a limited period of time, and to know that we're going to be competing with the computer system or the electronic medical record during that limited period of time. And so for our patients, we really try to offer the opportunity to just sit, take as much time as we need to get through as many problems as we can, and then if we can't get through everything, we have the opportunity also to reschedule sooner rather than later most of the time. And then, like you said, that's not a barrier because of needing to have a copay or anything like that. It's just about figuring out when the time is right for someone to come back in. And so we've really tried to get rid of as many barriers as possible, the barrier of access, the barrier of time, barriers of expense, because we feel like primary care is something that should be accessible to everybody. And I think Holly used the example in your first session together of car insurance. And, we think about primary care as all the stuff that needs to be done. It's not really optional to ignore it, and it's not really in your best interest, in your health, matters in the long run. And so if we can make that easier for people and remove as many barriers as possible, that's what we try to do. And we try to make it as simple as possible to understand, too. So like you already mentioned, our system is a membership system, and that's what direct primary care means. It means we have a direct financial relationship between the provider and the patient, and we eliminate any other financial relationship like between insurance or anything like that. The patient can have that, and in fact we encourage insurance or health share for catastrophic things that aren't just primary care and things you can't count on. But for our membership fee, it's based on age. You pay it once a month. We don't have copays. If we do have extra charges, we know exactly what those are. But many things are also included. We have procedures that are included, so minor skin care, mole removal. If someone has a cut that needs to be sutured, all of that is included in that monthly membership fee. If we need to do other types of like female health treatments, those are included. We just try to make it as simple as possible, and again, just get rid of any barriers that someone might have to getting their care taken care of.
And it's so much more reasonable versus having to pay all the different levels of deductibles and, having to go to multiple different places. And I feel like you guys listen. Just to give you an example, I've had a health issue that has gone back, and I swear I was probably about 14, and it was after a wreck. And it was actually found from your practice, and Holly was the first person to listen when I said, listen, it hurts from here to here. It's always hurt, and I don't know why.
Right, yeah.
And then they found it, and it was like, oh, well, that explains a lot. Otherwise, I never would have known.
Yeah. Yeah, and it's just a matter of having the time and then getting to know our patients well. So another characteristic of a direct primary care practice like ours is that we have much smaller patient panels per provider. So a typical primary care provider is going to have anywhere from 2,500 to 3,000 patients in their panel, and that's because we have to get those patients through the door and get everybody seen on some kind of full schedule in order to really pay the bills in a traditional system. And in our system, that's not how things are set up, and so we're able to have a much smaller panel, anywhere between 550 to 650 patients per provider. So we get the advantage of knowing our patients very well, sometimes to the point that, we are able to sort through things just like your experience was and figure things out that there just wasn't opportunity to figure out before because of those other constraints. So that's definitely an advantage that we enjoy about our practice as well.
And it is pretty awesome, just so that everybody listening knows.
Thank you so much.
Okay, so we're actually getting to stay home. Forcibly, but we're getting to stay home.
Right.
Which means that we're getting to work outside a little bit more and do a little bit of different things that we might not get to normally do. So with that happening, what are you guys getting calls about the most?
Thankfully, we are getting some of our normal springtime type of calls and maybe even a little bit more traffic there. So we're getting calls about rashes and poison ivy, which is not atypical for this time of year. I think the reason we're getting more of it is because, as you said, more people are getting outside. People are working in their yards when they may not have had the opportunity or the time to do that before, and they're getting exposed to that. So we are definitely hearing from patients that they're getting itchy, bumpy rashes, some bug bites and things like that, although I would say we're still a little on the early side for that. And then we're still getting some of our typical, regular routine, a little bit of late summer or late spring, allergy symptoms, and like a little bit that we talked about the last time I was on with you, the congestion, the itchy, and the watery eyes, and the sore throat, some of those pollen-related or blooming flower-related kind of things. And again, because more people are working outside, I think more people are experiencing that either at a higher level than they have before, or maybe where they haven't experienced it at all before. So lots of things that seem like normal, which is good. It feels good to have some normalcy.
I am, for the first time, planting a garden in years and years and years, and so I'm hoping to stay away from the poison ivy, and I'm actually hoping that by being able to work from home, my plants actually live. So we'll see.
I think that's great. Are you planting vegetables? Are you planting flowers? Some of everything?
Both. But this will be the first time with a real true garden in probably 10 years.
That is awesome. I firmly believe in the power of some vitamin D and some dirt therapy, that's for sure. So that sounds wonderful. And you know the rule about poison ivy, right? Leaves of 3, leave it be, and the little leaf looks like a mitten. So if you picture a mitten that looks like the hand part is one piece, and then there's a little kind of thumb sticking off the side, and it'll be in a group of 3. Don't touch it.
Got it.
Okay, good.
Okay, so normally, if we were having a normal year, what would that look like for you guys, just in case it should actually happen?
Yeah, so for our practice right now, one of the things we would normally be gearing up for would be lots of well child visits and school physicals or sports physicals, as well as summer camp physicals. And so I guess I would encourage people still that are listening to still think ahead about that, because we don't know how things are going to look. We may not have a lot of notice if camps are going to be proceeding or canceling. Same with sports and, sort of return to normalcy in the fall. So we in primary care really recommend that every kiddo, no matter their age, once they're in school, that they have a checkup every year. And sometimes it's easy to remember to do that around their birthday, but once they are, middle school age and wanting to participate in school activities and sports and things, it really helps to have that visit scheduled sometime after May 1st. That's the required date that we have to use for a physical to certify someone for their school physical. And so this is kind of the time to start thinking about that. Our schedules fill up pretty quickly with physicals, especially as we get closer and closer to school, and it kind of becomes back on somebody's radar. So knowing, too, that vacations and trips may be a little bit more limited this year, we would encourage people to just think about going ahead and giving us a call and scheduling a time to get in for that. Okay,
so we're obviously living in a COVID-19 world, and with my daughter working in healthcare, the first thing I thought whenever I knew that she could be exposed was, what could I be giving her or making sure she's taking? And I know Holly's talked about this a little bit, but probably just should hit on it again, just in case we start integrating back in, and you're obviously running a little bit higher risk by doing that. What could people be doing right now to get their body in prime condition to make sure that if they do get it, it's not a death sentence? It's more likely to be, just a really bad cold.
Yeah, sure. This is definitely developing evidence. So, what I'm saying, just like what we've said the last few weeks, may change shortly, but what we see as a pattern is that, in general, patients with other underlying health conditions, just anything that's kind of chronic that puts a strain on your body, so high blood pressure, obesity, diabetes, those types of ongoing diseases, those seem to be a higher risk factor for patients regarding COVID. So while, my advice is not going to work for you to just cure your diabetes or, resolve your high blood pressure, I think it comes down to good common sense and healthy lifestyle. So exercising, the recommendation is still for general exercise, 150 minutes of kind of moderate exercise in 1 week. So, 30 minutes a day, 5 days a week, or you can split it up however you want. You can do it in 10-minute increments if you want to. But we know that positive stress of exercise on your lungs and your heart really gets you in better shape to be able to fight off infections and hopefully keeps things from becoming as severe. And then also just good general healthy nutrition. There's been some talk about whether vitamin C is helpful. We know that in general, vitamin C probably supports your immune system, and so it has very little potential harm to it. Vitamin C is water soluble, which means that your body just flushes any extra that you take out. So, a vitamin C supplement or vitamin C in your food. Bell peppers are one of my favorite sources of vitamin C. I actually try to eat one of those every day. So, those are the kind of things that you can do to make sure that you're in prime shape as far as your own body, knowing that also we're seeing exceptions to every rule and that we're all still trying to sort out exactly what COVID does, how it behaves, and, knowing we can't guarantee any of these things, but that these probably set you up the best to have the best outcome with COVID.
Okay, we're going to take a quick break for a word from our sponsors, and we'll be right back.
Southwest Topeka has a good neighbor. State Farm agent Jim Garrison, now at 29th and Urish. If your current insurance situation has you going around in circles, get off the roundabout and stop in and meet Jim and his wonderfully efficient staff. Let Jim Garrison give you a quote and make the Garrison comparison. He's confident that with State Farm's competitive rates, the right coverage, and his unmatched service, you'll want to make him your new insurance agent. Like a good neighbor, State Farm is there, and Jim Garrison is there for you, northeast of the roundabout at 29th and Urish.
When someone has a passion for what they do, it comes through in the product they provide their customers. Just ask LaRocco's Pizza's new owner, Jason Johnson, about their crust. They make it every day and let it rise for a minimum of 24 hours before they use it for their pizza. And his staff doesn't want to do anything they won't be the best at, and you can taste it in their pizza. LaRocco's Pizza, just a half block north of the I-470 and Gage Boulevard exit. Come taste the difference.
At SportsMomsUnited.com, we celebrate every athlete and support every sports mom. SportsMomsUnited.com is on a mission to put logic back in youth sports. When you ask young athletes why they play sports, their number one answer is fun. For them, that means being on a team, making new friends, having a good time, all of which are awesome memories. We add to the memories by featuring an athlete of the day and sharing their story. Nominate an athlete today at www.sportsmomsunited.com.
Thanks for joining us again. This is Carrie Brown, Associate Broker with eXp Realty and the Preferred Advisors team, and you're listening to Real Estate 101. And I am back with Dr. Jennifer Heriter of Oasis Family Medicine. Good morning, Jennifer.
Good morning again.
Okay, so prior to the break, we were talking a little bit more about COVID, and obviously this past week we've had some interesting protests. More people have been around each other. Hopefully nothing catastrophic happens from that. Obviously people are getting stressed out and ready to get back to work and, all the anxiety we've talked about in the past. But let's talk about people out and about and wearing masks. What is the proper way to be wearing these?
Good question. If you are going to wear a mask, which the CDC has recommended that we universally wear a mask of some sort if we are going to be around anybody else, it needs to cover your mouth and your nose. It really needs to be sitting up along the bridge of your nose, and it needs to be pretty firmly applied to the sides of your cheeks as well. So I feel like some of what's going on is these are becoming kind of more of a fashion statement or, an accessory, and that's fun. because you might as well express yourself with your mask, right? But it also has to do the job that it was designed for. And in order for that to be the case, you have to cover what's called your mucous membranes. So viruses love to bond right to the inside of your nose or bond to the inside of your mouth, and then that's how they are able to infect you and make you sick. And so if you don't cover those surfaces, you're as much at risk as if you weren't wearing the mask at all. And then the other thing about it is if you are wearing a mask because you are trying to protect people from whatever you might have, coughing, sneezing, even just breathing hard, you're not protecting anybody if you don't have that mask up over your nose. So if you're going to wear the mask, make sure it goes from the bridge of your nose to underneath your chin and really across your cheeks, and it needs to fit pretty snugly. It's not meant to be comfortable. Unfortunately, it does feel a little bit claustrophobic sometimes. So, maybe this is a little bit of a ploy to get us to avoid being out and about so much if we have to wear masks all the time. I don't know, Carrie, but I do feel like, if you're going to wear it correctly, or it really doesn't give you any protection. And I think, unfortunately, sometimes we think, I have my mask on, I'm safer, or, I have a little bit more freedom to get a little closer to somebody, or maybe, rub my nose or something like that. And so we feel a little bit cavalier about it, and it gives us a little bit of a false security. So that's the other thing to be careful with about masks. It really doesn't mean that we don't need to still social distance. We want to still keep our distance from each other to protect each other from whatever might be going on.
And obviously, as far as the KDHE guidelines and stuff like that, and testing, and you had mentioned that things are changing daily and you're learning new things, but testing-wise, how has that progressed while all of this is going on?
Initially, testing was really limited because of, first of all, a combination of some things, supply issues, both from test kit supplies to protective equipment, and then it was also a little bit unclear exactly who should be tested and how and when we should test them. There was a really specific way initially that we had to use to test, which was to do what's called a nasopharyngeal swab, and that makes is a little bit of a difficult test to do. It has to really be administered by someone else because you have to use a swab that goes pretty far up in your nose and it's pretty uncomfortable. And so to do it to yourself is very difficult, but you have to do that in order to get a good test. And so as things have developed, we have different methods for testing. So we're able to do things that are a little more gentle, which means that a patient can do it themselves. We can, use other equipment that wasn't initially approved that is now, so we have more test equipment available. And then some of the protective equipment has become available, although there's definitely still a limitation there. So over just these few weeks since all of this has really emerged, we've seen a lot of changes in the options that are available for testing. So when it was so limited, we also were limiting who we were testing because we wanted to make sure we were confirming the very sickest patients had COVID because it affected how they were being treated, and then those that were most vulnerable. And so the CDC had set some priorities for us, and now just this week on Tuesday, KDHE changed what they are defining as a person under investigation, or a PUI, which sounds pretty serious, but this is just someone who probably should be tested or who ends up being tested. So there are some risks that they want us to look at, and basically that is whether someone has had contact with a person who is known to have COVID, whether someone has traveled, and there are still some places that are considered higher risk, but really it's what we're asking is really, have you been out of this city? Have you traveled outside of your normal, neighborhood, work pattern, whatever that is? Have you gone outside of that normal area for you? And then they also are including people under this risk that really just have no exposure risk or no history of travel or known exposure to somebody. And so with those things, then they're asking us to verify that someone has clinical features, so symptoms, fever, which we can come back and maybe talk about fever. And fever for everyone is 100.4 degrees. That's how we define fever in medicine. It doesn't have anything to do with where your temperature lives normally, because we know, 98.6 is an average. That means we know people are lower normally, some people are higher normally, but fever, medically speaking, is 100.4. Chills, shakes where your muscles all kind of seize up, muscle aching, fatigue, headache, sore throat, that cough and shortness of breath type symptom, and then the ability, or you kind of lose your ability to taste and smell sometimes, which is a really interesting, unique feature of this illness, and then also lower GI symptoms, so like diarrhea, where we don't have any other reason for someone to have diarrhea. So if someone has two of those symptoms, really, at this point, we are at liberty to make a decision on testing them, no matter what their risk is. And that has helped a lot, because we know sometimes people are having very atypical presentations of this.
Not everybody gets a fever, correct?
And not everybody gets a fever. There are some interesting ongoing study, but what it looks like for looking at hospitalized patients, something around only 40 to maybe 50% of patients being admitted to the hospital with COVID actually have fever, and those are going to be the sickest of the sick because they're needing hospitalization. And over the course of their hospitalization, somewhere around maybe 80% are developing fever while they're there, but that leaves a good 20% of the very sickest with COVID that don't have fever. And then for those that have milder symptoms and don't require hospitalization, we really aren't sure how often fever is completely, occurring, because we aren't able to verify some of those cases, but the suspicion is it's actually not a really reliable symptom necessarily. If you have fever and some of these other things, it increases our suspicion, but if you don't have fever, it absolutely does not mean we can rule it out.
So, telehealth, how is that working in all of this?
Telehealth has come a very long way from the beginning of sort of COVID fear to this point. And I think it's been really good in a lot of instances, because it has taken some infrastructure that was in place, kind of, I think, for a lot of systems, and really forced the issue. So for us personally here at Oasis, we have telehealth available with both phone and video conferencing, but what we're finding is comfort level is highest with just phone. And I don't know if that's kind of screen burnout, on our part and on the patient's part or what, but just having a phone visit has been adequate for most of what we are doing. Where telehealth adds an extra advantage is if there's something, obviously, we need to be able to visualize. And so, here again, where we're talking about some of these normal springtime maladies like rashes and bug bites and poison ivy, it can help to have a visual. Our Oasis patients know that they can always send us a text or an email with a photo of a rash or of a bite, and we're able to use that to help guide our treatment, and we've done that all along. That's not new for us. Where we're seeing a big advance is in a lot of our specialist counterparts. If we have a patient we need to refer, at this point, most of them are having an initial visit with telehealth, and that's ranging from general surgery to occupational therapy to ear, nose, and throat. All kinds of specialists are using this tool now, and I think our patients have really liked it. We suspect people will potentially continue to request those type of visits for, a situation where it's appropriate. It means less time off work for them. It means, if they live out of town and the specialist is only available certain times, it doesn't restrict their travel. I just think it's going to maybe change the landscape of what we offer on a routine basis for patients, and I think it's really appropriate.
So during this whole month, we really haven't talked a whole lot about you guys needing patients, because obviously right now that growth is you're where you're at right now. But you do have a waiting list. So if someone wants to get on your waiting list, how do they do that?
The best place to do that is through our website, and our website is www.oasisfamilymedicine.net. And there's a ton of information on there about direct primary care in general, about Oasis specifically, about our membership and what it includes and what it doesn't include. And up in the upper right-hand corner, there's an option to join our waiting list.
And if you're looking to buy or sell, be sure and give me a call at 785-213-5188. We are still listing homes. We are still selling homes. Obviously, we're taking safety measures. But overall, our listing inventory for March was only down by like 9 listings. So this market is still moving. Don't think that you have to wait until all this is over with. We can keep the process moving. So be sure and give us a call. And thanks for listening to Real Estate 101.
Thank you for listening to Real Estate 101 with the Carrie Brown team from Preferred Advisors.